Hi, good afternoon, everybody. Welcome to Practical Parenting. We are the Parent Collective. And if you've joined us in the last maybe month, every Saturday, your parent experts from the Parenting Collective come on and discuss a parenting issue that we all contribute to the conversation of. So before we start, let me just talk about the Parenting Collective. So the Parenting Collective is a group of parent experts. We all started out as friends. I became friends with these wonderful ladies through my wife, who has been friends with them since uh, since high school, I think. And so, how this group came out to be was um, during when we'd see each other. So you'd share about your experiences with your kids, and then we realized that there was a gap in the information that you could access about parenting and the experiences of parents in general. So we decided to come together and share our expertise and our knowledge. So now, my name is Rafi. I'm part of the Parenting Collective. I'm a licensed psychologist, and my practice is has been primarily with adults and adolescents and parents of young children, and I help them to adjust to their new roles as parents and to adjust to the more challenging behaviors that they encounter. We also have, for today, our topic is about potty training, bedwetting, and night terrors. So, for everyone that's watching us, if you have any questions, please leave it in the comments below for all our viewers on Facebook Live. And for everyone that's catching us after this live webcast, please feel free to leave your comments there and we'll try to get to them as soon as we can offline. Okay, so we're about to start. So for today, we are fortunate to have um, two guests today, two other members of the Parenting Collective. So our first guest is Dr. Andrea Carag, who is a pediatrician. And then for the other guest, we have Maria Campos Lopez, who is a sleep expert and a positive parenting expert. So without further ado, we'll bring them in where they can introduce themselves more and their areas of practice. So we'll have first welcome Andrea. Hi.
Hello.
Hello.
Hi.
Welcome. So
Thanks for
Andrea,
having
why don't yeah, thanks for coming. Why don't you introduce yourself first and your area of practice?
All right. Hi, everyone. My name is Dr. Andrea Carag. I am a pediatrician. I practice here in Parañaque. I have my own clinic. It's called the Pediatric Clinic, along with a few local hospitals nearby. Uh, we have been open. The clinic itself has been open for about 20 plus years, but I just joined them maybe 2 years ago. So
Mhm,
we've been expanding this business online as well. So please
mhm.
check it out, the Pedia Clinic page on both Facebook and Instagram.
Okay, thanks, Doc. So everyone, if you have any questions about parang your child's health needs, please feel free to drop over to their social media where they can find your other contact information. Okay, and then for our other guests today, we have Ria. Hi, Ria. Welcome. Oh,
Hi.
you're on mute, Ria.
Yes, hi
There.
everyone. Afternoon. I'm Ria Campos
Hi.
Lopez.
Good afternoon.
I'm the founder of Himbing, Child Sleep and Behavior Solutions. So I talk about getting our babies to sleep well, and I help parents
Yeah.
figure out how to be the parents they want to be. So I work closely with
Right.
Rafi and ask him a lot of my
Yeah.
questions as well. I'm also on my way to hopefully um, getting my license, no? So I started my master's in psychology too. So
Right.
if you
Right.
have any questions about sleep for your
Mm-hmm.
kids, maybe for you as well, feel free
Yeah.
to send me a message at himbing.ph.
Okay. So for everyone, that's this is Ria, and she's joining us also for this talk today. And so, just to remind everyone, if you have any questions or you'd like us to address later on, please just put them in the comment section. We'll try to get to them towards the end of the talk. Okay. So let's jump right in. I think today we're going to talk about uh, potty training and some sleep related situations. So let's start with parang just talking about when do we start potty training kids? I mean, how early should we be doing it? And so anyone can jump in about this first.
And
Uh, sure. Okay, I'll start. Though I think I've done a little research also. So it also some other cultures have different practices. But we've heard that some other countries they practice it as early as 9 months. But generally, from a doctor standpoint, it's best usually to start a little after 18 months. Because this is the time that kids usually have better sphincter
Mm-hmm.
and bladder control. So sphincter control and control of the pelvic floor muscles. So this is what controls everything down there. So controls the wee wee and the poo
Yeah.
poo. So as they are starting to learn how to control this, this might be a good time to start introducing them on how to use the potty. With of course making sure that you don't scold them all the time. I think.
Yeah.
But definitely, so usually you can start at around 18 months, and the general
Mm-hmm.
time to do it is around 2 to 3 years old.
Okay. Ria?
yeah, and we'd also like to make sure we look for signs of potty readiness, right?
Mm-hmm.
Or toilet readiness, as we like to talk about it. Because I always like to say there's a few things we actually can't control with our kids:
Mm-hmm.
sleep,
Mm-hmm.
eating, and going to the toilet, right? No one
Okay,
can
okay.
tell you when to go or to
Yeah.
stop. I'm sure we've all been in that situation where you really, really need to pee, right?
Yeah.
And no amount of my saying, don't do that now, will it stop, right? So we
Right.
need to see a few signs really that they can, if they're starting to learn control or they can tell you, or let's say
Mm-hmm.
for the younger kids at 18 months, if they've soiled their diaper,
Right.
right? They can let you know how, or they don't have to verbally tell you, but they can go up to you, or like my
Right.
son pulls at his diaper.
Right.
We can see interest also, like if you can introduce a toilet or I don't know why we actually call it potty, but we can introduce the small baby toilet, right? And see if they show interest in sitting down, right? If they can walk over and sit on it comfortably, even without having to do anything, right? So it's really just introducing it. But actually, my point, or what I want to stress on when it comes to potty training, is again taking out the word training, because like we said, we can't teach anyone to control, right? Their need to use the bathroom. So we really want to talk about allowing our child to learn. So it should actually be maybe toilet learning, and introducing it to our child properly. So yeah, so as Andrea mentioned in the last of her statements, actually, a good time to start is really when you see your child is ready. Because another thing is it's very hard to set expectations for our young children if they're not physically or mentally ready to do the skill. So we always want to make sure that we're ready to set them up for success. So like mentioned earlier, if they can communicate that they're upset about their soiled diaper, if they show interest in the toilet, we can show them that we go to the bathroom. That's actually the best, right? So you can, and most of the toddlers actually follow us to the bathroom. So we're pretty good at that. So, tell them when you're going to the bathroom and verbalize, mom's going to use the toilet and I'm going to pee, right? And then, pee, wipe, then wash your hands and all of that. And
Right.
as your child shows interest, you can also explain that they can do it, right? So that would be the biggest thing. And when we talk about readiness, it's also that the parent is ready.
Mm-hmm.
The
Yeah, yeah.
parent is patient, right? And like it's a mindset of my child is learning a new skill. I cannot get upset for every accident because there are going to be accidents, right?
Right.
So that's one of the
Yeah.
bigger things. I think maybe Rafi, you want to pop in about this, the parenting aspect.
Yeah, so parang of course I think last week was when we kept saying na at the end of the day the parent is the adult in the room. So you are the one who can manage your expectations and manage how you feel about that. So So parang kanina I before I got cut out, I think just to summarize, we were looking at there's an age range um, um, where it's good to start considering potty training, but also there seems to be a cultural aspect to it where some cultures have their own traditions that work for them. And then at the same time, we are also considering a developmental perspective where we have to look if the child is starting to recognize that they have that control, and also the parents developmentally also in that parang new role they're coming into. So parang a lot of these things come into play. There's the age, which is the easiest one, and then there's the parang knowing your child and knowing yourself aspect kind of thing, no? And so
Yeah.
when we jump into parang starting potty training, maybe we can share parang what can we consider parang or what practices can we try so that we can be more, I guess, successful in potty training.
Yeah. And
Yeah, I just wanted
or
to add to the signs of readiness.
Mm.
Usually, you'll notice your child will have bowel movements on schedule. Like you'll notice now, oh, he only makes poo poo in the morning.
Mm.
So definitely, that's one more sign of readiness. Just going back to
Mm-hmm.
that, and then I don't know if you mentioned it, having longer periods of having a dry diaper.
mm,
Usually, you see that the diaper is dry for around 2 to 3 hours, and then okay,
Mm.
they're now able to control it a little better, and then
Mm-hmm.
also having a child that can follow one step command. So simple things
Mm-hmm.
like
yes,
go to the potty. So if they can understand that,
walk
I
walk to
think
the bathroom.
to the bathroom
Yeah.
also. I think that's definitely part of it. So these are just signs
Okay.
that you watch out for.
Okay. So those are good things to consider. But so what when we're there now, when we have these
Yeah.
signs, what can we do to make potty training a more pleasant experience for both child and parent, I guess?
Okay. So first for me, I'll
Mm-hmm.
start is that we have to be ready to go for it 100%. So when we're
Mm.
going diaper free, we're
Mm-hmm.
going
Mm-hmm.
diaper free. We're not doing this. I'll put a diaper because it's nap time, or oh, he's going to poop. I'm gonna put, or he didn't poop yet. I'm gonna put a diaper on. Right?
Okay.
It's really very all or nothing. So to put ample time aside for that. I mean, there are a lot of
Mm-hmm.
books that say it's a 3 day potty training crash course,
Yeah.
but I don't really believe in that because we can't again clump all our kids together, right? So each child is
Mm.
different. So one kid
Mm-hmm.
might get it in one day, and
Mm-hmm.
another might take a week to two. So
Yeah.
to set time for that, that expectation also that it might not be solved in 3 days. So go
Mm.
diaper free. Be
Mm-hmm.
prepared for a lot of accidents
Right.
for sure,
Right.
and be prepared to not react.
Wow. Okay.
Wow.
Right? The accident is coming, guys.
Yeah. Yeah. Yeah.
So when I say not react, of course react in a calm tone. Don't like freak out, get mad,
Mm.
start shouting,
Mm.
start equating the accident to a bad child, right? It's an
Right. Right.
accident. So it's really that. It's really making sure that okay, anak, okay, I'm going to change my child at least 20 times a day, or I'm gonna have to clean the floor at least 20 times a day.
Right. Right. Right.
And if I think that's a big mindset. And then, of course, after they do have the accident, very
Mm-hmm.
calmly tell them, oh, you had to pee. Next
Mm.
time, tell mama ahead and then
Okay.
go to the bathroom and physically
Okay.
bring them.
Okay.
Ask them to pee in the toilet, even if they don't have to,
Yeah.
right? Just to repeat the motion and
Right.
clean them up in the bathroom. And
Mm-hmm.
again, not making a big deal out of
Good.
it.
I think that's
Mm-hmm.
good.
Yeah, I mean, not of course cleaning and again in this tone, anak, oh, okay, this is the bathroom, this is where we pee, this is where we
Mm-hmm.
poop.
Yeah,
So
yeah.
Mm.
next time you feel like you have to, let's go here. And
Mm-hmm.
again, you may or may not make it,
Right.
right?
Right.
But it's just that repetition. They have to make that connection. Pee, go to the bathroom, right? Poop,
Mm-hmm.
go to the bathroom, not
Okay.
pee where
Right.
I am, because again, that's what they're used to.
Right. So hold on,
No?
Ria. So
Yes.
does this mean for those you can use the toilet? Can we use the toilet, not the big person toilet? We have to
Yes.
set up a potty for them. What do you think? Parang logistically, what are those things that we have to consider?
Well, okay. Oh, that's a good question, Rafi.
Yeah.
I think it's either. Some people do have the small toilet at home, right? So
Mm-hmm.
they can sit on it. But
Mm-hmm.
in my house, we just bought the toilet cover and a step stool for the big toilet.
Okay. Okay.
So you could do that also. I guess it would
Mm.
depend. It's sort of hit or miss also. It would depend on your child. Are
Mm-hmm.
they scared? Because, and then that goes into some children think the big potty is too big.
Okay. Right.
Or
Right.
if you
Right.
don't have a proper small size the thing that fits on top of the seat
Yeah.
so that they can
Yeah.
sit, if you don't
Yeah.
have that, obviously they won't sit properly, so they'll feel like they're falling, and
Mm-hmm.
that's again on jarring. So if you
Right.
don't
Right.
have a fixture for that, then I recommend
Mm-hmm.
getting a small one that they
Okay.
can sit
Okay.
on, because remember,
All right.
everything that's our child size is very
Yeah.
helpful to them. Okay, so sorry, it's
Okay.
an added expense for the parent,
Right. That's
but it
true.
makes it easier for their learning, right? That's exactly
Mm-hmm.
why they make all these child size stuff, to
Yeah.
give them the
Yeah.
confidence,
Yeah. And.
Yeah.
right?
Yeah, so I have a question. So if let's say I have patients who, when they do buy a potty, like a separate one,
Mm.
does it have
Mm-hmm.
to be in the bathroom? The toilet
Mm.
setup, or
um
can it be in the playroom, like more accessible to the child?
yeah, in the start it could be accessible, and then
Uh-huh.
you can slowly move it, but if you
Mm.
have to change, always
Mm-mm.
change in the
In the
bathroom.
bathroom. Okay. Okay. Right. Got it.
Does,
So.
does it make sense? You can leave
Yeah.
the potty in the playroom, because remember,
Uh.
they don't have good bladder control yet. They might tell
Right.
you, I have to pee, but as soon as they tell you, that's when they
They peed
pee.
na. Right. That's right.
Yes. So you
Yes.
do want the small potty or the toilet to be accessible to them.
Right. Right.
Once
Okay.
they're good at going to that, you can move
Mm-mm.
it. Then move it
Okay.
to the bathroom
Okay.
and
Or the
start
See.
walking with them.
Right.
Because the other
Okay.
thing, maybe I'll just jump it before I don't recommend, and a lot of people say, I'll just bring my kid to the bathroom every 30 minutes to check if they have to.
Mm. Mm-mm.
Okay.
Yes.
If so, again, just flip it over to an adult. If I go to you, Rafi, do you have to go to the bathroom? Rafi, do you have to go to the bathroom? Rafi, do you have to go to the bathroom? It's very disruptive for the
Right.
child.
Right.
So it also doesn't make sense if they're not showing a lot of cues or a lot of
Mm.
readiness, because that just
Mm-mm.
adds stress to you and your
Right.
child. Because after the third trip, do you have to pee? Do you have to pee?
Yeah.
And the kid is
Sit-
saying no, and then you're getting like
Mm-mm.
freaked out
Yeah.
because
Because
nothing's
you're
happening.
because you're disrupting their day, but you're also disrupting your rhythm of the day just to get through that parang very rigid sequence, I guess. No, so
Yeah.
parang okay, so parang those are important logistical considerations. Access, parang I guess, parang if you summarize that, it's access. Initially, you'd want them to have more accessibility to if it's a potty or your grown-up toilet, no. And then parang it's there's another thing yung about association, making the association na this is the place to do it, ganyan. And then the reaction, your how you react to the event if there's an accident, no, so parang those are important considerations for potty training, right?
Yeah.
That's so parang so I mean sounds easy, but but I guess let's add, parang if we add to that parent mindset is another thing, we keep
yeah.
parang that's been
Parent is
our
fine.
parang that's been our go-to these last few talks na parang parent mindset, really having that mindset na oops, I might have to clean a little bit more,
Right.
or and that and but if your mindset is that they're learning it, they're gonna get there somehow, and you have to be supportive instead of restrictive about it, then you have to trust that they'll get it eventually.
Yep. Correct. So
Okay.
it's actually a lot of hard work on the parent.
Yeah, it
Um,
is.
it is, and the adult who
Right.
has them.
Right.
So I guess
Right.
now's a good time to also bring up the term, my favorite word, consistency.
Yeah,
So
right.
if you have lots of caregivers at home, no, I
Mm-mm.
mean, again, extended households, we're still all home. We might
Mm-mm.
have a helper, we might have an in-law, we
Yeah,
might
right.
have our partner, right?
Mm-mm.
Who all have different thoughts and views.
Yeah.
Actually, my advice is, if you think it's a good time to start because now we're home. Actually,
Mm-hmm.
personally, I didn't start now. because I feel like I'm too anxious about too many other things, that
Okay.
if my child,
Right.
and he will have an accident
Mhm.
in his underwear, right? I
Yeah.
think that might
Yeah.
just set me off.
Right.
So
Okay.
I'm not in the right mindset to do it, even though my
Right.
mom has been bugging me saying it's the perfect time because we have nowhere to go. I said, yeah, well, next month maybe,
Right.
when
Right.
we know what's happening,
Yeah. And
is the
and you're
big
more
thing.
ready is I guess is the thing. If
Yeah.
you're as a parent, you're ready to
we should
to
we
take
should
on
put
the
that
challenge.
pala, parent readiness, because
Oh,
we
okay.
always talk about the child and
Yeah.
their
Oo.
readiness.
Yeah.
So
But
now
parent
it's
readiness.
Parent
parent.
mindset
Yeah.
and readiness. Yes.
Okay. Okay.
Yeah.
That's great. Sige. So I guess so parang I guess when you've overcome that stage of potty training, they're relatively getting it. But now suddenly all of a sudden, biglang oops, I know they're potty trained, but why are they soiling themselves? So I guess we're moving up in age. So mga maybe like 4 or 5 ganyan, and all of a sudden they're wetting their bed. Parang should I be worried about that?
Sorry, wait. Before we go to the older child, can I just go
Okay.
to the back to the toddler? So a toddler
Sure.
might have learned how to use the toilet, right? But
Mm-hmm.
there's also a regression also for
Mm.
young children.
Wow,
So
okay.
going back to things like not being consistent, the
Uh-huh.
stress of the parent. So a
Mm-hmm.
child might have been using the toilet well,
Mm-hmm.
but then given this ECQ situation where everything is not um, okay. I mean, right? There's different stress levels on different things. A child
Right.
might regress to asking for a diaper again, or only pooping or only peeing in a
Mm-mm.
diaper again.
Mm-mm, mm-mm, mm-mm.
Um, that is, I would say, for the situation we're in, is normal and acceptable. So I wouldn't
Mm-mm.
get mad at the child. Like,
Right.
remember, when a
Okay.
child has a regression, they're not doing it to give the parent a hard time. It's
Okay.
another form of communication that they're not okay. So if
Okay.
your child was using the toilet before,
Mm-hmm.
and then now is asking for a diaper, or will only
Mm-hmm.
poop in a diaper. So we have to talk about that balance before you shift up. What could happen if the adverse effects of bad toilet training,
Okay.
right?
Mm.
Because there's negative health effects. So,
Right.
but if in case your child does need to go back to a diaper,
Mm-hmm.
I think
Mm-hmm.
it's just keeping in mind why. So if it's still a
Mm-hmm.
toddler, it might have been because they were too young when you did the training,
Mm.
right? So if they still poop or pee in the diaper, that's okay. Keep bringing
Mm-mm.
them to the bathroom and keep cleaning them up there and keep offering the toilet again. And then
Right,
they'll
right,
get back
right.
to it. As
Okay.
opposed to getting upset, getting mad. And because then I'll bring that to, if you get mad at your child and they associate the toilet with someone getting mad at them,
Mm-mm.
okay, Ans, that's yours. What's the medical
Uh,
problems now?
so you see, well, I'm happy with agree with me with this. At 2 to 3 years old, so they enter what they call the anal phase of
Ish.
yeah, of psychology. So this is the time that they are starting to experience control over the sphincter muscles. So
Yes,
they're
yes.
starting to realize that, hey, I can do this. Why
Mm-hmm.
don't I do this all the time? And then
Mm-hmm.
what happens is if the parents start to get mad at every time
Mm-hmm.
they miss the
Mm-hmm.
toilet or they have to be
Mm-hmm.
cleaned up and then, ano ba yan? Ginis na naman. Sana dito ka na lang sa toilet.
Mm.
So they start to associate pooing with something negative. So what happens
Right.
is they have to retain the poo because they can already. So they
Yes.
won't poo. And now that is the nightmare of the pediatricians because the next the next thing will be you'll be calling your pediatrician and you'll be like, hindi pa po nagpupupo ng 5 araw yung anak ko. And then
Mm-hmm.
more of a this situation is really bad because now they have hard stools and then every time they poo, it'll hurt. And this
Okay.
cycle will go on and on and on unless there's some intervention. So this is what we call
Mm.
retention, or and then if it's greater than 2 weeks, it's constipation. And so
Mm,
this already
mm,
requires a little treatment and a little intervention
mhm,
from the pediatrician.
mhm,
So for me, that's
mhm,
one. And then
mhm.
when they retain their poo, if this prolongs, if they retain their poo, they tend to retain as well their urine. And I think every
Okay.
you retain your urine, your wee wee, this can lead to UTI.
Okay.
This is one of the
Okay.
causes of UTI in kids. So if
Uh,
they have fecal retention, that means they're also retaining some of their pee, and then it
mm-hmm.
progresses to an infection now. So now it's a little harder because now you need antibiotics. So that's why we
Okay.
also want a positive correlation between nappy time
Yes.
and bathroom time.
Okay. Okay.
Just to call that.
Yeah. So parang ano, aside from just like the effects, use the stress, no, there are physical consequences to
Yes.
parang if we don't do it parang properly or appropriately. Okay. Okay. Just to take this moment for all the viewers, whether live or later on, that if you have any questions, please put it in the comments below so that we can get to them and we can address your own potty training issues or challenges and help you through that. Okay. So let's go na to parang if they're potty trained na and they're okay na, and then this all of a sudden
Okay.
they're soiling. What's happening there?
Okay. So sorry, I have one step back because I have a question on my
Oh,
page. Sorry.
okay,
About
okay.
about when do you allow a child to potty train through the night? So toddlers, can they
Ah,
sleep
I
through the
see.
night
I see. Okay.
without diapers?
Right.
Actually, sorry, maybe to backtrack a little, the ideal would be
Mm.
we potty train when you know they can actually not pee at night. So it would be best, which is hard. It's a hard call though. It would be
Mm-hmm.
best for toddlers when you're potty
Mm-hmm.
training to limit already the liquid before nighttime, to
Mm-hmm.
offer the time to pee around brushing and before bedtime. And then of
Mm-hmm.
course before bedtime, no liquids. And ideally we would want to take out the diaper even for sleep. So this is the scary part.
Mm-hmm.
Because again, giving them back a diaper
Right.
is sort of undermining our confidence in their learning. So then this
Mm.
will go into now soiling the bed. If they soil the bed many times at night, it might also not be readiness. I mean, while you're in
Mm-hmm.
the potty training stage, huh?
Mm-hmm. Mm-hmm.
Before Andrea answers, what happens if they are potty? So this is to differentiate. What happens if they
Right.
are potty trained, and then you do
Right.
have the occasional bed
Right.
wetting.
Right. Okay. So parang ano, we have to consider also parang when we say when we were talking about potty training kanina, most of the time we were talking more about daytime dryness,
Yep.
no? Yeah, when in the
Yeah.
day, but nighttime that takes a while longer. I
Yes.
think that's an important point to make.
Yeah. I don't think you can delay it. Like it won't, it's not a two-step process. It's one
Mm.
whole. So if you're
Mm.
having difficulty at night,
Mm.
then don't get stressed also. I
Okay.
would think.
Okay.
Yeah.
Make those preemptive adjustments to your sleep time routine. Okay.
Yeah. Okay.
Sige.
Sorry, Anne. And then now moving to the older kids who have um, issues. I think this is a common question, no?
Uh-uh.
My
Um,
child has been potty trained for a while and then will
They're
wet the bed.
soiling. Right.
well, as a general rule, we usually expect bedwetting until about 4 years old in girls
Mm. Mm.
and 5 years old in boys. So it takes a little while longer.
Mm-hmm.
Um, Usually, by the time they're 53 months, only about 10% of the kids still do bedwetting. So we
Okay.
usually say, just to avoid accidents, is it okay? We usually advise to just leave a dry sheet.
Mm.
So yeah, yeah. So just to avoid mishaps because they will happen. And
Mm-hmm.
sometimes I've seen kids until about 7 years old, but still have once in a while accidents. Usually, if they're
Mm-hmm.
drinking, that they're peeing, that means they had
Mm-hmm.
a lot of liquid before they fell asleep. And
Mm-hmm.
then, diba, even as an adult, if you need to pee, you need to
Yeah.
pee.
Yeah, right. That's right.
After a while, medically, after a while, there's no amount of sphincter control that can keep that in, if it's really
Mm.
full.
Yeah.
But the same with the kids. So if they have a once in a while accidents until they're about 7 years old, it's still okay.
Okay.
So one off is okay. So
Yeah.
a tip for that, because we know that would happen. Like Andrea said, you can buy those mattress protectors, right? That are
Mm-hmm.
dry, or those.
Mm-hmm.
I don't know what you call it. And when you give birth in the hospital, but they give you a sheet,
Yeah, that's a dry sheet. Because, well,
dry
that's
sheet. So you put that. And then actually the system for younger kids is you layer it many times. So you have your bed, you have a dry
Multiple.
sheet, you have fitted sheet, dry sheet, fitted sheet, like maybe two or three. Because what happens is at night when they wake up because of an accident, you don't want to do that. Hi, no, you woke up like this, let's and then disrupt the whole sleep cycle as well. Just want
Mm.
to ideally your child maybe will call you, or depending on the age of your child, they're old enough to just fix
Yeah.
the themselves,
Right. Right.
right?
Okay.
And make life easier for everyone. It lessens the embarrassment and the stress
Right.
of
Right.
everyone. And then
Right.
yeah, for younger kids, for the parent, for the mom, it's much easier to just think, okay, I'm just gonna change his pants and then pull this off. Okay, back to sleep. We'll deal with this in the
Mm.
morning.
Right.
It
Right.
also makes the process much smoother.
Oh. So it's really about managing the environment, making it more conducive. I mean, aside from your expectations and your perspective, the
Yeah,
environment also. Okay. All right.
because accidents will happen, right?
Right. 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 And even
But
I
have
guess
Yeah, let's let's
uh,
backtrack. So how many layers
yeah,
was that? So usually
well, two
ten.
or three. I mean, because I think if they're soiling the bed more than twice in the night, then they're not ready to go for full toilet
diaperless
training.
the whole night.
Yeah. But
Okay.
if it was just if you're talking about an older kid who has the one off, then it's usually just
Mm.
one
Right.
layer, right?
Right.
Yeah, actually,
Right.
sorry. This strategy that I'm talking about with the many layers is actually for those babies who are doing sleep learning, and whatever you do, they leak out of overnight diapers. So
Oh,
just
Yes. Yes.
apply
Yes.
that concept to toddlers. Because it happens,
Okay.
di ba? The diaper leak is normal. So that's a
Mm-hmm.
strategy for
Mm.
for that.
Okay.
the diaper leak. Okay.
Okay. Sige. And then kanina I think Andrea mentioned that parang bedwetting is a normal occurrence till mga 5 for girls and then 6 for boys.
4 and 5,
4 and 5. 4 for girls and 5 for boys.
roughly.
And then the one-off bedwetting it's just parang that the assumption there is you just take care of it the next day kind of thing. You kind of expect pa one-off bedwetting, and then that's when you look at those parang sleep routine stuff. Okay. So anything else to add for bedwetting problems, I guess?
Is there a doc ans? Is there like a red flag when they have to go to the pediatrician? Or when do you know it's not a one off? How often is a not one off?
When it's starting to be again like that nightly,
Hmm.
Okay.
and I would definitely go see a doctor if you have other problems. So aside from bedwetting, you have other problems like in frequency, or if during the day they're not peeing as much, and then all of a sudden at night
At night. Okay.
it gets voided.
Okay.
Uh, when they have I have a whole list, but then it's a lot of technical terms. When they have giggle incontinence, when they're
Okay.
laughing and then they have a little pee come out. If that often
Okay.
happens a lot,
Okay. Okay.
yeah, and like that dribbling. If you notice that the in the underwear it's sort of soaked but not fully, so that
Mm.
the little head
Like
pass.
there's like like leaking pee.
Yeah,
Mm.
yeah.
Mm.
So that
Mm. Mm.
so these are anatomic problems. So usually, yeah,
Okay.
you go to your pediatrician. There's a long list for it, but then
Okay.
you can go to your pediatrician. They will refer you to
Uh,
a pedia urologist
right,
just to
right.
double check there's no
Okay.
anatomical problem.
So I guess those were parang just some things to watch out for, extra things. I mean, not all kids, very, very, very little kids will have those problems. But if you do have those problems, maybe it's good to mention during your well baby checkup or well child checkup to your pedia, and then they can make the referrals. Okay, sige. So that's parang we'll leave the potty training and bedwetting for a bit. Or Andrea, Ria, you wanted to add something.
Sorry, there's a question here asking
Okay.
for tips on potty training with twins and no help at home.
Yeah, so they have their
Uh,
own. I think we should have. I think with
one
twins, the important thing is to always each one should have their own.
Yep.
double the
And I
fun,
would
double.
Yeah, actually, I would say, could you observe your twins and see if they are both ready? Because it's
Mm,
possible that maybe just one twin is ready and not the
that's right.
other.
That's right.
So if you do observe very well, again, another favorite word is to observe and figure out
Mm.
potty readiness, right?
Right, right.
And if one child is ready, then I
Mm-hmm.
would focus on one child and let the other child be happy in diapers,
Mm-mm.
and then move on later on. So it's just one at a time.
Uh-oh.
You might, but this mom will feel like she's in the potty warp for a while. But
Yeah.
again, it's well, because my advice will always be to sort of follow the cues of the child. But if you
Mm-mm.
feel like your children are older, because there's no age here, so let's say they're both four, well, they're twins, sorry, they're 4 years old, and they're both
Mm-hmm.
obviously ready to start. Um,
Mm-hmm.
then I would just suggest doing it together. I mean, they'll have to learn how to take turns in the bathroom eventually,
That's right.
right?
That's right.
It's like having a sibling who has to pee at the same time as you. You just have to
Mm-hmm.
run to another
Mm-hmm.
bathroom
Mm-hmm.
at some point. So I
Yeah.
think maybe here it's more of the mental exercise again for you, mom.
Okay.
That it's going to be longer. It's going to
Yeah.
be a bit more challenging. There will be
Mm-mm.
more laundry,
Yeah.
but you are totally more than capable of doing it, right? You
Yeah.
can do it. So I think that's
Yeah.
it.
I guess
Um,
again,
for
I guess
me.
for that mom also, if you have parang if you want to share more details and ano, you
Mm,
can send us a message on the Parenting Collective. We'll have all of those contact information for everyone later on.
yeah.
Okay, so let's go now to maybe non-potty stuff. No, but definitely happen. We observe also a lot of the times at night. So could be a challenge is the last part of the day, which is night terrors. But I guess for most parents here, is a night terror another name for nightmares? Is it different? So parang how do we differentiate that?
Okay. So I differentiate night terrors and nightmares. Really, a nightmare is a bad dream. Is what we
Mm-hmm.
know a bad dream as we've experienced. I think we've all had our own bad dreams, right? You are jolted from your sleep and you wake
Mm-hmm.
up feeling
Mm-hmm.
many negative emotions. You're scared, you're upset, or even
Mm-hmm.
maybe shocked, or diba, it could be something unreal, and you
Mm-hmm.
wake up. And
Mm-hmm.
usually, when you wake up, or you will wake yourself up, and you will have an idea of what happened, either
Mm.
what happened or that, oh, something wrong happened, but you will be fully awake.
Awake.
So, like
Okay.
this now, like you will
Okay.
wake up. A
Okay.
night terror is one wherein the child, or even the adult, I guess it could happen, but the child usually you see might be shouting in their sleep, might be
Mm-hmm.
moving a lot in their sleep, looking
Mm-hmm.
uncomfortable, crying,
Mm-hmm. Mm-hmm.
but they never really fully wake up.
Mm-hmm.
It's like they're shouting for 5 minutes and then they stop and they go back to sleep.
Okay.
So it's sort of to liken it to something less stress. Well, it's just as stressful, but sleepwalking.
Right, right,
No,
right.
when a person is sleepwalking, they're moving but they're not
Mm-hmm.
awake.
Yeah.
So for a night terror, the child is shouting but they're not
Mm-hmm.
awake.
But I'm not awake. Okay. Okay.
Yeah, and
And
did I cover that? Sorry, in the middle of mid drink. But that's really how you differentiate it. Like, my advice always for kids with night terrors is you can't wake them up.
mm,
You can't rouse them awake,
um,
right?
yeah. So the medical explanation is that when you're asleep, there's a part of your brain that inhibits movement. So diba? Because you don't usually move, even if you were dreaming. You don't. If you dreamt you were flying, you're not really
mm-hmm.
flying, right? So you didn't really jump out of a plane and then start parachuting down. But
Mm-hmm.
what happens in all of these things, night terror, sleepwalking, sleep talking,
Mm-hmm.
for some
Mm-hmm.
reason, the inhibition is gone. So that's the medical
Mm-hmm.
explanation of what happens.
Right.
I just wanted to
Okay. Sige. So parang to summarize here, what's happening is, or the main difference is that nightmares, when they happen, they could rouse somebody, the child, or they can wake up. And then with night terrors, it's they're screaming, but then they don't necessarily wake up, or they don't wake up at all in the middle of that. I guess there's also a memory thing
yes, yes, I could have said,
that's
yeah.
involved na parang in nightmares there's a possibility they can recall it the next day, but night terrors they have no recollection that it happened. is the other thing that ano. Okay. So anything else to add parang to the definitions, I guess, for us
Yeah.
to or
I
I
think
think yeah.
I guess it would also be causes of these things
Mm-hmm.
would be similar. Nightmares and
Mm,
night terrors would both be caused by overstimulation,
right.
right? Oh, yeah.
There.
Overstimulation, overtiredness, lack of
Right.
sleep,
Mm-hmm.
is a cause. No, Ants? Did I miss anything else?
Stress.
Stress. Yes. Stress.
Yeah, then that leads to kasi not sleeping well, no?
Uh-uh.
So I guess
Uh-uh.
if you could go back to anything that causes you to not sleep well, or to let your
Right.
child not sleep well.
Right. Right.
My
That's right.
example always for causes of nightmare or night terrors is, well, when we were back in the real world, when you go to a birthday party and you have your baby
Mm.
and they're so overstimulated with the balloons, the noise, the sound
Mm. Right.
system, people
Right.
in their faces.
Right.
Usually, you'll notice they'll have a hard time falling asleep that night.
Mm. Mm. Mm.
Usually, when you see signs of your child having a hard time falling asleep, that might likely be the night of a night terror or
Right.
nightmare.
Okay. Parang they're overexcited. They got overstimulated throughout the day, I guess.
Yeah, I think that's the biggest one.
Okay. So parang so definitely some of the causes of night terrors is um they carry it from the day, from the previous day's activities. If it's too much from the normal,
Mm-hmm.
but also Andrea was starting to bring up something about stress and
Yeah.
how that could contribute to the night terrors.
Graphic freeze. Yes.
No, no, no. I'm
Um,
here.
okay. Well, yeah, so definitely stress can bring about these things. So we go back to how usually it's if the child notices that the environment at home has changed, or if there's a drastic change in the daily routine, like
Mm.
with what's happening now, that can definitely
Mm-mm.
be a form of stress. So
Right.
emotionally, when these kids get stressed,
Mm-hmm.
and then usually there's also a stress point in their daily
Mm-hmm.
routine. And this includes sleep
Yeah. Yeah.
and training
Okay.
and all these things. So these things can also get disrupted. That's why you might notice a little more of these incidents when times are a little stressful or
Mm-hmm.
emotionally
Mm-hmm.
taxing on these
Okay.
kids.
Okay, so parang if we make a link now, parang is the current situation that we're all in now. Although parang for many working people, it's ending by Monday. But generally, this current situation, is it the same kind, or is it causing this kind of disruption in children's lives? And you think enough to be causing bedwetting problems or night terror problems?
You want to go first, Priya?
Yeah, well, I'm going to say definitely. The last 2 months have brought many, many calls of parents saying their children are not
Mm-hmm.
sleeping well. I am one of those parents. My toddler is not sleeping well. Whatever I do, I mean, even though our routine is down, we've fixed a lot of
Mm,
things. It's still
mm,
very different. Um,
mm-mm.
and actually, Rafi, you mentioned that people are going back to work on Monday. That's another change. So I
Right.
would warn families that this might come up now in the next week. Maybe we've been
Right.
okay. Maybe you've successfully, and I know a lot of parents who have successfully potty trained their child over this break. And I'm really happy
Mm-hmm.
for them. But at the same
Right.
time, if mom or dad leaves the house now to go to the office every day again next week, we can
Right.
expect that there may be some regression again,
Mm, right.
right?
Okay. Right.
Yeah.
So parang
So
it's a
yeah.
sorry, Ants.
Again, any drastic change. So we were able
Yes.
to adjust already, and then
Mm-mm.
come Monday, we're all
Mm-mm.
going back to work. So this
Mm-mm.
going to change again. So you definitely expect some form of regression.
Okay. Okay. That's right. No. So parang it's a big disruption in their normal lives. And then parang coming up next week, we're transitioning to a more opened up society. and where parents go back to work, and then maybe it's this change na parang, oh, I used to wake up at like noon and my dad was still there, my mom was still in bed, parang in the room with me. But now come Monday, the parang it's a rude awakening of sorts na parang hala, nag-iba na naman. It's a different situation again. So we could expect some kids, although not all naman, not all kids, but some kids might not take this adjustment as well as others.
Yeah.
No.
So,
I
Okay.
think that's a good that's a
Yeah.
good statement. Again,
Uh-oh.
not all kids, right? So some
Right.
kids will adapt very quickly.
Right.
Um, for me, let's just say, for example, I've never so far with my kids experienced nightmares and night terrors because I'm like
Mm-mm.
very careful, diba?
Mm.
But there are some kids, or I don't know if even when you talk to your friends who were growing up, like remember having vivid
Mm.
nightmares, no?
Mm. Mm.
Parang me, I
Yeah.
never did naman.
Right. Right. Right.
my
Uh-oh.
So
child is in her sleep since since it's a regular occurrence.
Right. Mine so my for my daughter naman it's true kasi kunyari like especially more common towards the holidays like New Year when everyone stays up longer, there's festivities going all over, syempre because the apos are there, the grandparents are naturally no keep them up. So that's when I deal with the night terrors a lot more with my daughter. Yung talagang wake in the middle of the night, it's quiet, and then all of a sudden she's kicking and screaming. So parang definitely when there's stress, sudden change in the routine, too much stimulation, you can count on a night terror that night. Okay. Do we have any other questions? Guys, for all those who are watching, if you have any questions, please put them in the comments below. We're talking today about night terrors, bedwetting, potty training in general, or potty training questions. If you have, please put them down below, wherever you're watching. And so parang
yeah,
while we're looking for questions, I guess just to round out and summarize what we've been talking about now. We talk about potty training about the normal, but we're also talking about how disruptive this whole situation is. So a lot of these problems come out because this is how your children are dealing with the stress. You know, I find myself talking more and more about this as parang while we get deeper and deeper into like this quarantine situation. Okay, sige.
I just
Are
want
there any?
to
Yeah.
remind everyone, na you're going back to work on Monday. I think
Mm.
you should tell your kids, like,
Mm.
mommy's
Mm. Mm.
going back to work or daddy's
Yeah.
going to work. Okay, so parang
Mm.
you're not going to see us as often as you did before.
Right. Right. Right.
So I'll be
Right.
back in the afternoon, but it will be a
Mm.
little bit of a change. And I think you should do this every day, every day
Okay.
until you start getting used to it
Right.
again.
Right.
Yeah.
Right. Right. Parang I guess that's something that we have to remind parents that your kids are creatures of habit, talaga, especially up to a certain age. Those parents who have adolescents, ibang usapan yun. We'll talk about that some other time. But for those with like younger kids, toddlers, primary years kids, they're really creatures of habit. So if you notice a lot of the things we talk about, routine, and parang easing them in to any significant change, definitely
yeah.
helps them adjust better. Oh, there's a hello. Okay. So if
Mine is
there are
vibrating and
if there are no more if thanks everyone for watching. Thank you, Andrea and Ria. Any webinars also, the Parenting Collective, through our practical parenting live stream, we try to come up with new episodes every Saturday, usually at 2 p.m. Today lang, 2 p.m. So if you have, sorry, at 4 pala. 4 p.m. Philippine time. And if you guys have any suggestions for future topics, please put them in the comment section, in any of our social media accounts, which I will show later on. But any upcoming events, guys, or talks or webinars for you? Ria,
Yeah,
let's start with Ria.
Rafi, it's the two of us.
Yes. We have a, but when is that? I forgot. Wait, we
I
have
think in the
Ria
second
and I.
week of June
Yeah,
or first week
sometime
of
in the
June.
yes,
Yeah.
I think
So,
second week of June, Ria and I will be doing a repeat of our toddler talk. It's about toddler discipline and some sleep discussion. And then we'll post the dates, all the dates, and how to get on these talks and events will be on our social media. Okay, sorry, I just had a comment, a question, bigla.
Okay.
yeah.
Um, so here from Sarah.
Sarah.
Okay,
Hi, Sarah.
she says with the case for my toddler, when he isolates himself in a corner for quite some time, we know he's doing his business. Although when we ask him if he's pooping, he immediately says that he isn't. Would this be a sign that he's ready to potty train?
Oh, that's my patient. His favorite word is no. So, yes, I would definitely think he's just about ready because he can control
Mm-hmm.
it and then he has his
Yeah.
own corner. So, I
Mm-hmm.
would assume that he can put the potty in the
Yeah.
corner. You do what Scenaria just said. You just
Yeah.
wash him
Mm-mm.
in the bathroom. Even if he
Okay.
says
Yeah.
it's not, we all know that
Okay.
he
Yeah.
Right.
Sorry, I just want to pop in that Francisco's turning 2, and every time we see his poop face, like his
Yeah.
cue, and we
Yeah.
always ask him, "Let's go to the bathroom." But
No, no.
yeah, we slowly move him anyway. And even if he makes it to the toilet, then great.
Mm.
yeah,
Mm-hmm.
If he doesn't make it to the toilet, it's okay. You just clean up
Yeah.
the diaper and you say, okay, we're gonna poop in the toilet later or tomorrow or next time.
Okay.
So yeah,
Okay.
so Sarah, for my advice would be to just so when you see him, well, okay, yeah, Andrea's correct. Put the potty there first. But if you know
Mm-hmm.
it happens at a certain time of the day, you might also
Mm.
want to start walking him to the bathroom na first,
Mm.
and then offering the toilet. And then remember, when you ask him, "Are you pooping?" You don't want to say it in a you're pooping. Are
Mm.
you pooping? Watch your face. Because
Yeah.
it's also parang they feel Rafi, correct me if they're wrong, but they kind of feel that nahihiya na, di ba, at this
Yeah.
age. They feel
Yeah.
a little
Yeah.
bit of
Yes.
embarrassment
Yes. They
and
can
a little bit
experience
of stress.
shame. And remember na your kids are very, very good at picking up on your social cues, even in the toddler years. So they kind of know what is your parang angry voice or what is your frustrated voice. They know what your happy voice is. So if you so be careful with your tone. You know that's a challenge.
Yeah.
Sometimes even for me, it's a challenge to be mindful of what tone I'm using, but because they can definitely pick it up.
Yeah. Then sorry,
Uh,
maybe I'll change that. You don't want to ask him if he's pooping because you know he has already. So just say, "Oh, I see you're ready to poop," or
yeah,
"Oh, let's go poop in the bathroom." Sorry, let's change that.
right,
Let's not ask him, "Did you poop?" Because
right.
even just that, it's
know. Yeah.
like sort of a little bit on the aggressive side, right? But
Yes.
oh, if you can just announce it. So that's
Mm,
another parenting concept, right? Narrating or sportscasting, saying, "Oh, I think you have to poop. Why don't we go to
yes.
the bathroom?"
Yeah.
So sort of
Yeah.
offering it in that way
Mm,
might also be a better alternative.
okay. Sige. Okay. So again, thank you everyone that watched. Ria and I are doing our toddler tools talk in the second week of June. So for more details, you can head on over to the Parenting Collective on Facebook. Andrea, any upcoming webinars or talks?
Yes, our free webinar next week will be entitled To Enroll or Not to Enroll. So for those
Hot topic.
Yes.
yeah, for all those parents who were discussing on what to do with your children this coming school year, we'll be tackling all of those. You can drop us a DM if you want to share with us what your current school is planning to do for the next school year because we've been actually collating that data already. But then, yeah, so we'll just be discussing the pros and cons of keeping your children in the school that they're in versus doing homeschooling, which is
Okay.
a hot thing to do right now.
Yeah,
Yeah.
so I think Teacher Nicole will explain the differences, right, and what
Yeah.
it entails for the parent. Because I think a lot of things in theory are there, but how would it work in reality for the working parent
That's right. That's right.
and technology challenged parents?
Yes, we have those. Okay, so thank you again to our guests today, Andrea and Ria. Thanks for,
You.
and then we'll be flashing our social media accounts in a bit. Thanks everyone for watching, and we hope to see you guys next week at to talk about to enroll or not to enroll for the upcoming school year. Okay, have a safe one, everyone, and we'll see you next Saturday. Bye
Thank
bye.
you. Bye.
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 Okay, we'll put this up.